In this section, I'm going to give an overview of psychosocial treatments available to those with major depression. I'll go over antidepressant medication and brain stimulation therapies in parts 6 and 7 of this series. Psychosocial treatments can help people learn to manage their symptoms and improve their functioning. The treatments I'll cover are considered to be evidence-based practices. That means they're treatments which research has shown to be effective for people with major depression. Let's first talk about cognitive behavioral therapy, or CBT, which is a well-established treatment for depression. In CBT, people learn more about their individual experience of depression and about what they can do to improve their symptoms. The focus of CBT is on how thoughts, behaviors, and mood all influence each other. The goal is to help a person make changes in their thinking patterns and behaviors in order to decrease their symptoms. The cognitive part of CBT focuses on thoughts and beliefs. People learn to change their thinking patterns to be less negative and more realistic. The behavioral part of CBT focuses on changing unhealthy behavior patterns and increasing positive, rewarding behaviors. Behavior activation is one technique that is used to help a depressed person start doing activities that they will enjoy. For some, behavioral therapy alone may be enough to alleviate symptoms of depression. CBT may be done one-on-one or in a group setting. Mindfulness-based cognitive therapy is a treatment that uses mindfulness as a technique to manage negative thoughts and unpleasant sensations. In contrast to CBT, where people learn to actively change their thoughts, the focus of mindfulness-based cognitive therapy is on awareness and acceptance of thoughts and emotions, even if they are unpleasant. People are often on autopilot and not even aware of their experiences in the present moment. As a result of using mindfulness to be more aware and accepting of one's experiences, people can be less reactive to negative thoughts and emotions, and instead learn to be more calm and careful with how they respond. As a result, people can feel more in control of their lives and make healthier decisions, which can ultimately lead to decreased depressive symptoms and more joy. Acceptance and commitment therapy also uses mindfulness to teach people to be less reactive and more accepting of their thoughts and feelings. People learn to identify the negative thoughts and behaviors that feed their depression and other problems they are experiencing. People learn to accept what cannot be changed. They also learn that they don't need to be limited by what can't be changed. Instead, they learn new ways of dealing with their negative thoughts and behaviors, hopefully with less struggle. Sometimes a therapist will use metaphors to help illustrate how less struggle can lead to improved well-being. An overarching goal is to help people identify the things in their lives that they value most, such as family, work, social relationships, and community, and help them take action to support living in line with these values. The next treatment I want to talk about is called Problem-Solving Therapy, which is a short-term structured treatment. It's based on the premise that problems of daily life can cause and maintain symptoms of depression. By learning to identify and work on these problems, depressive symptoms will improve. People in problem-solving therapy will set specific and realistic goals and ideally gain a sense of control over their lives. Problem-solving therapy can be used in primary care and community settings. Let's discuss interpersonal therapy next. Interpersonal therapy is a short-term treatment for depression which focuses on how depression impacts interpersonal relationships, such as with family and friends. These relationships are believed to play a role in the onset of depression and in ongoing symptoms. In interpersonal therapy, the therapist and the patient work together on improving one or two problems that occur in the patient's interactions with others. The focus remains on these interpersonal problems throughout treatment. The idea is that depressive symptoms will improve if the person can make positive changes in their relationships and increase their social support. Let's move on to family treatment and psychoeducation, which is a way for families to work together toward recovery. Family treatment can play an important role to help both the person with depression and their relatives. Family psychoeducation is one way families can work together towards recovery. The family and clinician will meet together to discuss the problems they are experiencing. Families will then attend educational sessions where they will learn basic facts about depression, as well as learning coping, communication, problem-solving skills, and other ways to work together toward recovery. There are a range of family programs available. Some families benefit from just a few sessions, while other families may require more intensive interventions. Let's touch on alcohol and drug use because some individuals with major depression also struggle with an alcohol or substance use disorder. This is called co-occurring disorders or dual diagnosis. Co-occurring disorders are best treated concurrently, meaning that the treatment for depression should be integrated with the treatment for the alcohol or drug problem. Integrated treatments include cognitive behavioral interventions and motivational enhancement, which is designed to increase motivation to stop using alcohol and drugs. Integrated treatments are effective at reducing alcohol and drug use, preventing relapse, and keeping individuals in treatment longer. These interventions can be delivered either one-on-one or in a group format. Well, that wraps up our discussion of evidence-based psychosocial treatments. Join me next time as we talk about medication for depression.